Welcome. My name is Dr. Michael Rahman, and I'm a naturopathic doctor. I've been in practice now for well over 18 years. I started this journey actually much like most people in searching and finding out what it is that naturopathic medicine was all about. Now, when I started this, there weren't that many naturopathic physicians practicing in the province of Ontario, yet alone in Canada as a whole. At the time, I believe the numbers were only about 400 nationwide. So I had to do a fair bit of research. And it has become my life passion, if you will, to spread the news and spread the awareness of naturopathic medicine and what it might be able to do for you. I have a practice that is very multifactorial, multidisciplined, and as we will learn a little later in the slides, I combine the best of both an approach which is blended in understanding the philosophy of the systems which are old and rooted in tradition, and that which is new and integrated in cutting-edge diagnostic tools. So first and foremost, let's try to understand a little bit about what naturopathic medicine is. Really, it is actually a primary healthcare system. It is embracing both the old philosophies of medicine and that which is new. It is a system that provides both treatment and diagnosis of disease using scientifically proven principles with a real focus here on prevention. The difference here is that we are not looking at a reactional model, we're looking at a preventative model. And so when you sit with a naturopathic doctor, it is equally important to understand that which you might have some vulnerabilities to. And the focus here is on integrating the entire, the whole, through providing customized, individualized patient care. The principles of naturopathic medicine are what guides each and every naturopathic physician when they sit in order to provide the adequate treatment for an individual. First and foremost, it is about doing no harm. So we look towards always being able to ensure that we are using safe and non-invasive techniques that will not actually provide any negative side effects or harm in conjunction with any conventional care or conventional medicine that you might be receiving. The second is, of course, we're harnessing the power of the body to respond to the forces of nature. The healing power, if you will, is inherent within our bodies. And really what a naturopathic doctor does is looks for ways of teasing that power out in the individual. We look at identifying the cause of the illness rather than just focusing on providing symptomatic relief. And so, in fact, we'll be looking for the root illnesses. Say, for example, if someone is coming in complaining of digestive concerns, we look for what might actually be underneath that. The person is treated as a whole, and so in that same digestive circumstance, the individual might actually be suffering with thoughts and emotions which might actually be hindering how they are digesting food. So as a whole, understanding we are looking towards the sort of complex, if you will, that is driving some of the symptoms. Therefore, we are treating the whole integrated individual. Health here is seen as promotion and looking towards promotion as the best preventative tool. Really, our vantage point is so different. We are looking at a very highly trained individual professional that has a vantage point that is very unique, and this allows the person sort of sitting in front of us or sitting in front of me to tell me a story, and sharing their health story can actually help me weave and integrate where they might be now and where they might be headed, again, with a focus on preventative care. It might be that things such as improved energy, better sleep, feeling better, not knowing why you're feeling off, but still knowing that you're feeling off or feeling sick, and wanting to actually have some understanding and answers. A lot of times, I can't tell you how many times, but a lot of times patients are coming to me actually saying, well, all my conventional tests are normal, and my doctor says that all my blood work is normal, but I'm still not feeling well. The biggest tool that a naturopathic doctor has to offer as well is education. And education is one of the key components of what doctors do. for patients. And so what we hope to do here is to provide a framework of understanding the things that are going wrong for you and look at integrated wellness solutions that might be alternatives, if you will, for drugs and surgery. A focus that is key with all naturopathic doctors is to look towards the diet as a source for potentially dis-ease. So that which is creating unease in the body. The diet might actually be a big factor. And so we look at teasing out the factors within the diet that might be contributing here. This is all individualized and based on individual physiology. These are things, of course, that might actually also lead us down the path, digestive issues, might lead us down the path of difficulties with weight and metabolism and energy. So these are all things that might, again, drive a person to seek out naturopathic care. The education and license of a naturopathic doctor provides a very solid foundation for being well prepared with extensive research and evidence-based training. It is approximately 3 to 4 years of university education as a prerequisite for basic sciences. This then follows for a 4-year intensive medical education at an accredited institution, and there are only a few. There's about a handful in North America, and we can find information on the websites here that provide information about naturopathic medical education. There are then rigorous licensing exams. There's a set of 2 licensing exams that naturopathic doctors have to pass to be awarded a license in which to practice in the province or state, and membership in provincial associations and national associations also is encouraged to allow the naturopathic physician to keep their level of education and standards up to date. It's important to note here that education and licensure also ensures that you, as a consumer, as an individual, as a health seeker, actually are sitting in front of someone who is well-trained and well-positioned to take on the responsibilities and the roles as your health advocate. The things that you might be able to expect from a naturopathic doctor can vary depending on the type of practice. Just as we are all our individuals, we are all going to practice a little differently. However, there are some things that can be considered pretty foundational in terms of your naturopathic visit. First of all, you can expect that the visit is going to take a little longer. You can expect that doctors of naturopathic medicine are going to sit down and spend time with you. They really want to know the types of things that are maybe driving the health pattern for you or your health story. So it is really, again, that which is important in understanding the complexity of what might be happening here in order to provide the information for the support and the various treatment options that we might have. So the initial consultation, again, might take an hour. In my practice, it actually takes an hour. In some naturopathic doctors' practices, you can be looking at anywhere from an hour and a half to 2 hours. Follow-up visits are then usually anywhere from 15 to 30 minutes in duration. This really allows the time needed to really have a thorough understanding of the history, the contributing factors, other health concerns, and status of the individual as well as their family history. If needed, a discussion of things like lifestyle and routine and dietary habits is taken into account as well. There might be a review of supplementation and medication, a review of the systems, including all the other things that might not be on your radar, such as how are you breathing? Are you breathing shallowly? Are you eliminating your bowels every day? And these are things that may not, until you're questioned, may not realize that this may not be as optimal or normal for an individual. Then there is a review of laboratory markers and imaging and any other relevant clinical information or pertinent information. And this is where the naturopathic physician might actually be thinking that there might be a place to order more of these standard diagnostic tests so that we can ascertain the complete picture. I actually like to tell patients, for me, I'm almost like a diagnostician, or I am like a mystery hunter, detective, if you will, in putting all of these pieces together. And sometimes we use conventional strategies and conventional diagnostic tools to get that. There are also other types of strategies that naturopathic physicians might use that are a little more unconventional. Our core strategies then, the things that we use therapeutically, once we have a fundamental base understanding of what might be going on for the individual, a core strategy might actually be to look at nutrition and diet. And that might also then include lifestyle modifications, such as how are you eating, when are you eating, how quickly are you eating, etc. Or it might be to take a look at meditation and stress management components in one's life. Botanical medicine, which is the use of herbal medicines. The traditional Chinese acupuncture and Chinese medicine. And here, this includes the botanicals as well as the energetics used within food to help balance the organism. Homeopathy is, in fact, the use of small, energy-based principles that stimulate the body's processes to heal internally. Physical medicine are attributes and modalities such as hydrotherapy or the use of hot and cold water to actually help stimulate the organism. In physical medicine, we also can use modalities such as hands-on techniques such as tissue work, physical manipulation of the body, and also technologies such as laser and ultrasound and units such as TENS units. At PINEWOOD, which is the clinic that I have in Toronto, and again, we've been in existence now for well over 17 or 18 years, the types of treatment strategies that I have at PINEWOOD have to do with advancement in the diagnostic realm. We use heart rate variability, which is a measurement of how well the body is regulating, especially under times of stress. We also provide customized dietary and weight loss routines that help understand what the metabolic functions are of the body. Bioidentical hormone replacement, which helps restore that which the body loses naturally over the process of aging. Supportive cancer care, microscopy, and thermography, which are again diagnostic tools. We also provide IV therapies in which to provide nutrient and vitamin support directly bypassing the digestive tract and allowing the nutrients to get absorbed more effectively in through the blood systems. Food intolerance testing is a way to actually use, again, blood chemistry to identify the foods which might be challenging to our immune systems and therefore challenging to our bodies and can be responsible for all kinds of symptoms, such as skin irritations, irritations within the digestive tract, of course, as well as fatigue and vulnerability to diseases. And we also provide at the clinic an allergy elimination technique called NAET. Now, if those of you are interested, at the end, my last slide, I'm going to give you information on where, or resources on where you can derive more information on any and all of these different techniques. The good thing about naturopathic medicine is that most healthcare insurance plans will actually cover our treatment strategies. Patients are encouraged to actually check on what in fact can be covered, and a lot of naturopathic practices will work within that sort of realm of coverage. And there are certain sort of strategies that can be utilized, such as the sort of understanding or the descriptive analyses that is given on a receipt or on information given back to the insurance company via letter and letterhead, so that patients can get the best coverage that they may be entitled to. Now, one might think, why would I consider going to PINEWOOD? Well, altogether, we have well over 35 years of clinical experience. This means that we are highly trained. This means we have I've treated tens of thousands, if not hundreds of thousands of patients, and therefore have been providing quality, superior, compassionate care since 1997. This also includes the fact, or we also are very proud of the fact, that we are a multidisciplined team of nutritionists, chiropractic, osteopathic, massage, and acupuncture in order to provide the most integrated of healthcare systems and healthcare approaches. We offer many innovative packages as well, which can include all of the different cosmetic services, IV therapies, and innovative packages designed specifically for weight loss. For those that want more information, It would be helpful to take a look at contacting our clinic at the 2 locations that we have to serve you in Pickering at 905-427-0057 or in Toronto at 416-656-8100. And let's not forget, of course, the web as a wealth of resource. You can take a look at our website, www.pinewoodhealth.ca, and for the most up-to-date and innovative tips and strategies and offers from the clinic, please take a look at our Facebook page and like us on the Facebook page. That way you can sort of follow along with us as well. And here is our address, facebook.com/Pinewood Natural Health. There are lots of other things that we can offer to you. We have a blog that you can take a look at, as well as we have a mobile application, again, that will keep you up to date, especially with the going-ons at Pinewood Natural Health Center. I really hope that I've provided at least a glimpse of what naturopathic medicine is, and why it might be beneficial for you, and especially why you might make Pinewood your go-to for quality natural medicine and integrated health. Thank you for listening, and I hope to meet with you really soon. Again, this was Dr. Michael Rahman from Pinewood Natural Health Center.